Hi, this is Dr. Sriman Narayana, surgical gastroenterologist and laparoscopic surgeon, Medicover Hospitals, Begumpet. Today, the most important topic is gallbladder stones. This is the more common disease nowadays people are facing. So, coming to what are the complaints regarding the gallbladder stones? The people will say most commonly is the indigestion problem and the bloating. The stomach will be tightness and they will feel that the food is still in the body, in the stomach, like a indigestion problem. Next common one thing is right side stomach pain below your ribs. So people will complain like that. So these are the two more common things. And regarding the complications of gallbladder stones, the people will complain of jaundice and some people will get the pancreatitis also. Coming to what are the investigations the people has to go commonly for gallbladder stones is more common is the ultrasound abdomen to rule out any gallbladder stones. And how many stones, the size of the stones, how is your liver drainage pipe system, any infection in the gallbladder. Why I am asking is, suppose if the patient have only gallbladder stones, the only treatment is laparoscopic cholecystectomy, that is the removal of the gallbladder. The people always ask why the gallbladder has to remove. Why means if any gallbladder, if it is not functioning, then only the stones will formed. Suppose if I remove the only stones, because already gallbladder is not functioning, the function is already over, again the stones will be formed immediately within 1 month. So last 120 to 150 years, the only surgery for gallbladder stones is removal of the gallbladder along with the stones. So what are the issues after the gallbladder surgery? That is the more common question asked by people. There is no issues after gallbladder removal because it is already non-functioning. But only condition is the patient should not take any oily food after for 1 month after surgery. After that, the patient can eat like a normally only. So coming to the complications of gallstones, the first and foremost complication is infection of gallbladder, that is called as cholecystitis. Because if the stones is blocking the drainage pipe of gallbladder, it will cause the infection. So what are the treatment for the infection? If the patient like a appendicitis, previously we call it as 24 hours pain. Nowadays even for appendicitis also we can wait for 72 hours to go for surgery. Like that for gallbladder stones, if it is any infection like a cholecystitis, we can go for surgery for 4 to 5 days. Before 4 to 5 days we can go. After 5 days, if the patient complains to the hospital, only antibiotic has to give for 1 week, then patient has to wait for 1 month, and after 6 months of attack, 6 weeks of attack, the patient has to go for surgery. That is the same surgery, laparoscopic cholecystectomy, that is removal of the gallbladder. When to do open surgery? So many people are asking, sir, can you go for open surgery because everything will be visible now, you can do with your hand, all these things. Generally, laparoscopic visibility is 100 times more than the open surgeries. Okay, so high definition cameras will be there and the total abdomen will be visible. So nowadays, 99% surgeries are doing by laparoscopically only. If I am doing laparoscopically, any problem within our abdomen, then we can go for open conversion. So lap convert to open is the better. Don't go for directly open surgery. After surgery, any complications? That is the more common question. Any complications for gallbladder surgery? No complication if the case selection is very good and people should follow for 1 week. After 1 week, the patient has to come. If any complaint is there, you have to go for ultrasound examination. My professor always told me, if the patient after laparoscopic surgery, if the patient is not recovered well within 48 hours, like up to your mark, that means something happens in your surgery. So we have to go for ultrasound examination if the patient is not recovered after 48 hours. So how to prevent the gallbladder stones? Actually, previous olden days we will tell that more common in F, that means 40 fertile females. But nowadays we are seeing the gallstones from day 2 years of age to 8 years of age group. So there is no precautions or no preventive measures to prevent the gallstones. The only thing is always is for any disease, the only thing is balanced diet, like more veggies, and carbohydrate should be 60%, protein should be 20%, and 20% should be the oily. Should be the balanced diet. And coffee, tea after breakfast, not on a empty stomach, and the diet should be the home food maximally, that is the breakfast, lunch, dinner should be on time. Don't do intermittent fasting, aggressive weight loss, because if you do the intermittent fasting, the gallbladder function will be damaged very early. So don't do intermittent fasting or some religious fastings. Not a religious fasting, that more hours of fasting, don't do it. Aggressive weight loss, don't do it. You are always a chances of gallstone diseases. But specifically, one food will causes the gallstone, one food will prevent the gallstone. That is not a matter. That is not. It is a subject of errors. So get good nutrition, eat balanced diet. Surgical diseases. Thank you.